Hi, Brandon NICU nurses. My name is Catherine Van Antwerp, and I'm here today to share some of the exciting news that I will be implementing on the unit that is tailored to parent discharge preparedness home. To briefly give you a little background about myself, I graduated from the School of Nursing here at University of Michigan back in 2018, and I also live locally to the city of Ann Arbor. I briefly was able to spend some time back in the NICU in 2017 as one of the nurse externs, and I've also done some behind the scenes work on research teams and quality improvement teams to gather and analyze data that is NICU specific. So I'm here today because I'm going to be implementing new work that I'm so excited about to help parents feel more confident and empowered as they discharge home. It is my goal that with a parent-facing discharge tool, parents can go home feeling more empowered and ready to take on the care of their infant from their NICU stay. And today I'm going to show you exactly what the My Flight Plan for Home Tools use looks like, as well as what it looks like for parents and to you, part of the NICU staff. Thank you. This here is the My Flight Plan for Home tool that I will be implementing to parents nestled within the unit. This tool was created here in the Brandon NICU, and its use ended a couple of years ago due to low use and cost of printing. However, from previous research studies, we have learned that parents love the use of the tool and want to be more engaged in their infant's care. This tool provides the pathway for exactly that. I am excited to now be bringing the My Flight Plan for Home tool back into the NICU in a parent-led way with the hopes of more successful implementation and overall tool use. I will be coming onto the unit to immerse myself with parents of patients to help foster discharge preparedness home by exposing them to the use of this My Flight Plan for Home tool. It is my goal that over the next few months, by sitting down with parents one-on-one and introducing this My Flight Plan for Home tool as parent-driven, that parents will feel that they too can be a part of their infant's care team and find ways to positively impact patient care that will make them feel more confident in discharge home from the unit. With a printout of this tool, as well as a parent educational guide to understanding the My Flight Plan for Home tool, and the opportunity to discuss the tool and its use with myself in person, I am confident that the parents will have an understanding of the tool's use and its next steps. As you look at the tool here, you can see many different care topics that parents can be and may already be involved in on the day-to-day in the NICU. The tool is designed to have many ways parents can be involved, from the time of admission all the way through preparations for discharge home. For example, no matter how acute the patient, parents can always be educated and learn ways to care for their infant by providing mouth care or calming and soothing. As babies hopefully progress in their NICU stay, it is the goal that with the tool, parents can also progress in ways to care for their baby, such as diapering or holding, to name a few. This tool highlights partnership between the NICU staff and the parents as caretakers and allows parents to visualize ways they too can feel they are providing care for their infants. It is now important to highlight what the nursing expectations are for the implementation of the My Flight Plan for Home tool. Overall, there should be minimal change to the day-to-day nursing shifts. The goal of the tool is to be parent-facing and parent-driven so that the things they ask may be about or be looking to discuss in relation to the tool are things you as nurses are already doing on the day-to-day, that is, educating and providing care. It is more so expected that nurses have an understanding of the tool and its use so that if parents would like to address a topic bubble on the tool or are hopefully eager to find more ways to be involved in their infant's care, that this tool will be a mutual ground on the partnership to do just that. As nurses, you are expected to encourage appropriate engagement between parents and their babies during their NICU stay. Expected to offer nursing advice and education on the My Flight Plan for Home tool topics when asked. Answer any questions parents have or concerns that relate to the My Flight Plan for Home tool and their baby, as well as display excitement, support, and encourage the use of the My Flight Plan for Home tool. Now let's talk about what is not expected of nurses in relation to the My Flight Plan for Home tool. Remember, again, this is parent-driven, parent-facing, and I will be coming in to have one-on-one talks with these parents to display the tool, show its use, and encourage its use throughout their stay. So it is not up to the nurses to initially present the My Flight Plan for Home tool to parents. Additionally, it is not a nurse expectation to educate or teach parental skills that are not appropriate for parents or not related to the My Flight Plan for Home tool. For example, medication administration would remain in the hands of nursing staff. And finally, it is my hope that nurses would not avoid providing education and or answering questions that parents have in relation to the My Flight Plan for Home tool. This is supposed to build that sense of partnership and collaboration between parents and their nursing staff to ultimately empower parents to prepare for discharge home. So it's my goal that now that you've seen the My Flight Plan for Home tool and understand its use and a little bit more about nursing expectations, that you feel more confident and ready to discuss this with parents and answer questions they may have in regards to the tool. I'm so eager to come onto the unit and begin these sessions with parents and discussions and introducing the tool and answering questions and ultimately passing it off to the parents, because remember, this is parent driven, parent facing, and ultimately this helps to build and foster that partnership and collaboration to help them become part of their infants and your patient's team. So if you have any more time, I would encourage you to look at the tool a little bit further just to gain more of an understanding. But I really look forward to seeing some of you on the unit. And there is an attestation survey for you to sign after watching this module. Thank you so much for your time and hopefully see some of you soon.